Welcome to the Census, looking at those working in multi-professional advanced clinical practice in England and how this supports current and future patient care. Why are we doing this census? There's never been a national survey on advanced moving workforce transformation. We need to anchor this census in the reality of people's experience and future needs to help make better decisions. We are working to improve ESR's ability to collect this data, but in the meantime we don't have a baseline. So we're taking a snapshot of people's experience either working in or supporting advanced clinical practice. So what are we going to capture? We want to look at current workforce, numbers, professions and the specialities they work in, how they're aligning to the multi-professional framework, what types of practice are supported by this level of staff. We want to be able to offer targeted support to the things that really make a difference. Who are we looking at? We're looking at those working at all levels of practice which requires complex assessment and treatment and a high degree of autonomy. Those who can demonstrate they are meeting the core capabilities of the 4 pillars of the multi-professional framework. So these 4 pillars, they outline the capabilities of advanced practice. We're looking for staff who align to the pillars. We're looking at what training and support is in place and what governance frameworks exist to ensure safe and effective practice. Where are the gaps and challenges that, moving forwards, will need support and a collaborative approach? Who will be doing the census? We need to begin or add to ongoing conversations about advanced clinical practice in line with the national multi-professional framework. So there will be 5 surveys. 1 to local Health Education England officers giving an overview of the ACP agenda. 1 to higher education institutions. What's out there? Is this working towards mapping to the framework? 1 to organisations and trusts. What staff support and governance structures exist? And 1 for individuals. What are their experiences of being advanced clinical practitioners? What are their experiences of training and what support's available for them? Finally, 1 to primary care, to GP practices, similar to the organisational questionnaire, but tailored to general practice. For higher education institutions, we understand that you work in a competitive market, and respecting that, we want to better understand any capacity issues and challenges you may face. How near to aligning to the multi-professional framework are you? What opportunities do you see, and how can we work more in partnership with you? For organisations and trusts, we are reaching out to whoever leads this group at trust or organisational level. We're looking for numbers and which professions and specialties are represented by this staff group. How can we support you to help staff address gaps when mapped to the framework? By looking in all departments, where are those staff working at multi-professional advanced clinical practice level? They may be clinical scientists, nurses, pharmacists, or any of the 14 allied health professional groups. We want to help support the development of governance around practice, and we want to look at future training and supervision needs, service developments, what needs to be in place. For individuals, we want to see where the people are who have a job description, a job plan, and a role aligning to the multi-professional framework pillars. In other words, working at advanced practice level. The system needs greater understanding of roles that individuals have in order to support the development of better training. We want to drive systematic improvement to meet the needs of the national agenda and long-term plan. The primary care survey to GP practices. This is similar to the organisational questionnaire. What are the numbers of staff working at this level? Which professions and specialities do they work in? What governance structures are in place and how is training and support provided? Are practices beginning to align to the multi-professional framework? Thank you for taking time to listen to this video. We'd like to thank you in advance for taking the time to complete these surveys. We'll be inviting you to take part this summer. Health Education England will use the information to support and inform future training and service development for those working in advanced clinical practice.